of the pelvic binder and provide structural support of pelvic volume when pelvic packing is performed.
So that it corresponds to the intraoperative position of the patient. The anatomical landmarks for the supraacetabular positioning of the Schantz screws are the palpable superior anterior iliac crest and the inferior anterior iliac crest, which is rarely palpable. The insertion site for the Schantz screws is 4 to 6 centimeters caudal and 3 to 4 centimeters medial of the superior anterior iliac crest, that is just distal of the inferior iliac crest. The Schantz screws are angled 10 to 20 degrees cranially and 20 to 30 degrees medially. For the technically simpler positioning of the Schantz screws in the iliac crest, the anterior edge of the superior anterior iliac spine first has to be determined. From the tubercle of the iliac border, which lies about 4 centimeters dorsal of the superior anterior iliac spine, a strong rim runs obliquely in the ventral direction. However, this direction is not suitable for the anchorage of the Schantz screws. Although it's easy to find an insertion point on the broad iliac crest, a secure hold for the Schantz screws is difficult to obtain in the thin wall of the ilium. For a better purchase, the supraacetabular position is recommended. The supraacetabular positioning of the Schantz screws is now shown. The ideal insertion point is located between the inferior anterior iliac spine and the ventral lip of the acetabulum. This insertion point is best found with a template 5 centimeters caudal and 3 centimeters medial of the superior anterior iliac spine. The Schantz screw is inserted through the outer sleeve of the drill sleeve assembly. It is angled 20 to 30 degrees medially and 10 to 20 degrees cranially. The cell-drill Schantz screws can be cautiously inserted with the air drive. Care is taken to ensure that there's good purchase in the bone. The final turns must be made by hand, so the air drive and the drill sleeve are removed, and the universal chuck with T-handle is mounted. In its correct position, the Schantz screw lies deep and firm in the bone. This stability allows considerable forces to be transferred in the ventral as well as in the dorsal part of the pelvic ring. The second Schantz screw is inserted just cranial and slightly lateral to the first. The tips of the screws should converge slightly towards one another. 2 Schantz screws are inserted in the opposite side in the same manner. The position of the screws is checked. The insertion of the supraacetabular Schantz screws is more demanding. However, the anchorage in the bone is better. For the ventral stabilization, 2 tubes are connected at an angle with the tube-to-tube clamp. Here, 1 short and 1 long tube are provided for each pair of Schantz screws. The tubes are fixed to the Schantz screws with the conventional adjustable clamps. All the nuts are tightened with the socket wrench just enough to hold the tubes in place. Now the anterior pelvic ring can be reduced. The tube-to-tube clamp and the adjustable clamps are tightened. The stabilization is completed with the second tube assembly. To improve the fixation, the tube assemblies are further stabilized with 1 or 2 cross braces, consisting of open adjustable clamps and a Steinmann pin inserted diagonally. The protruding ends of the pin are covered with protective caps. Finally, all the nuts are checked for tightness with the combination wrench. Surfaces can be marked with K-wires. The first screw must be inserted through the solid iliac crest with the drill sleeve assembly. Even experienced surgeons find it difficult to place the shank screws in the best position, because partial perforations of the thin ilium may occur in the inner and outer walls. However, perforations are acceptable if the tip of the shank screw is firmly anchored in the bone. On the opposite side, the shank screws are inserted into the iliac crest in the same way, and the assembly is completed with 2 pairs of tubes.